Welcome to the Codecast Podcast. Real-world insights for your daily medical coding and billing processes. And now, here's your host, Terry Fletcher.
Hello, everyone, and welcome to the Codecast Podcast today. My name is Terry Fletcher. Thank you for listening in today, for your downloads, and we really appreciate your loyalty and referring these podcasts to other listeners. We just really appreciate all of that. We work really hard to bring you a quality product each week. And today, actually, this episode, I had to start over about 4 or 5 times. Apparently, I've had a lot of coffee today, and I've been talking very quickly. So I switched to iced tea, which also has caffeine, so I'm not really sure what's going on there. But it's just funny because I get started and then I get on a roll and I think, okay, no, that's not going to work. But today, hopefully, you'll find that this is an enlightening topic. We're going to talk a little bit, kind of circle back to audits and offer, why an audit can be a fix for poor coding compliance, lagging reimbursement, but also why it's so important that coding and documentation audits are really performed in your office now more than ever. You heard my rant last week with regard to the new CMS proposal on E&M services, and quite honestly, there's a lot of practices out there that are panicked and thinking, oh my gosh, we're going down to a one code system. And so you really want to make sure that you have information and you can quantify why you need to have certain levels of service. And so this is good time as any to make sure that you really have, that peace of mind and an audit in your practice. If you do it internally, make sure that you go back and really take notes on some of the things we've said in our podcasts. I've given you a couple of things in episode, looks like 28 and 29 back in March. One is how to influence your physicians to make your mark, and the other one is really how to write up an audit proposal so they'll buy into doing that. And then for the physicians or administrators that are on the call, obviously that's something we do in my business. So if you need an external auditor, please let us know and we'd be happy to help you out with that. But what we also want to do is make sure that as we go through some of this information, I just want to let you know where kind of the reimbursement issue is there and where the money is. One thing for me is that, auditing, coding, documentation, and money all intersect, and everybody is so afraid about talking about the money part, except me. I like money. I hope you do too. But everybody calls it something like reimbursement and fee schedule. I call it what it is. It is money, and I want all of it if we can get it. So we want to make sure that we're maximizing our revenues. See what I did there? Another word for money. But they're trying to cut your money, and so we want to make sure that documentation, yes, has always been traditionally for compliance, making sure you're doing things correctly. But the other thing is that they also find errors, mistakes, and things like that. I look at it as an opportunity, not just as a training tool, but an educational tool, but also an opportunity to see, okay, what am I not capturing? What is this practice doing that they can support, but they're not being, they're not billing for it. So we also want to look at that and just make sure that, you have a complete submission when you submit that claim form, that you're not leaving money on the table. And so audits, as they're more important than ever, it's not just to counteract the CMS proposal, but it's also to make sure that you are protecting your money. And so you're going to hear me say that a couple times. I just can't say it enough. Everything I do or everything I try to do, whether it be podcasting or auditing or oh my gosh, educating, I write books and, I ventured out into medical waiting room designing. Everything I do, I really try to do it with where is my opportunity to create money and wealth in that area. And maybe that's kind of narcissistic for some people, but you have to look at the big picture, especially if you're nearing retirement age, especially if you're in a career path that you work for yourself like I do. So you have to make sure as a physician's practice, that you're looking at these issues and these opportunities with high costs of healthcare and just with how expensive everything is going out your door, that you're looking at everything from that perspective of revenue and money and reimbursement, whatever you want to call it. So before we get started, the Codecast podcast is brought to you today by Keck Medicine of USC, over 500 nationally renowned physicians at a leading academic medical center, keeping you healthy, on track, and doing things you love. KeckMedicine.org, ranked in the top 50 hospitals in the country by U.S. News and World Report. Medical Economics, smarter business, better patient care. MedicalEconomics.com for the business of medicine, digital magazine, and health IT. And also, just know I had an article dropped in Medical Economics magazine this past week, so feel free to take a look at that, and hopefully you'll get a little chuckle about me ranting. They said, "We're not changing anything you say, Terry. You're pretty funny." And I'm like, I am funny. So we just want to make sure that we have to add humor into what we do. Otherwise, we would lose our minds. Let's face it. It's a tough thing to be in the medical field nowadays, especially in the political climate, and just trying to do things right and keep our, physicians on track. And so sometimes it definitely gets tough. So as we get into this audit fix, what I'm looking at is really, looking at the ever increasing complexity of healthcare. It's driving the need for coding quality and compliance programs. And, given the transition to ICD-10, we've had also a lot of advancements in treatments and procedures. We've made the big move to quality reporting and evolving regulations with kind of some lofty penalties if you don't comply. And so the lost reimbursement at stake as a result of poor coding is driving more and more providers to intensify their coding and audit programs, which is what we really want to do. So what I'm finding is the trend among large providers is a wave of both random and targeted audits at varying stages of the revenue cycle, from pre-bill to post-bill analysis, and so retrospective versus prospective analysis of key issues ranging from denials to specifics such as, a transfer of care. But audits can really help uncover potential problems and issues, such as coder knowledge and deficiencies and workflow and documentation hiccups, which could be, quietly chipping away at your money. See, I said it again. And also at patient care. So random and targeted audits usually or certainly have their place. Identifying the purpose or goal of the audit is really the key to determining the most effective approach. So random audits kind of offer a strong, unbiased approach to evaluating where general weaknesses and educational needs exist. And they also may identify some new issues each time they're conducted. The random audits, though, that you do internally, I have a practice right now that just asked me for an audit. And it's interesting because they just wanted 5 records per physician. And I thought, okay, we'll do a random focused audit and it'll be 5 established patient visits. No, they wanted 1 established, 1 new patient visit, 1 hospital visit, 1 procedure, and 1, what was the other one? 1 critical care. Now, there's nothing wrong with that. If that's what you want, that's what I'm here for. But my concern is that it's not a focused audit. So if you pull 1 hospital note and you tell a physician they overcoded, they're going to look at you and say, well, just that one. That's the one you picked and you just happen to pick one. What you're looking for in an audit is you're looking for a trend. You're looking for a pattern. You're looking to see what your physician does normally, not just one record to say you did this one thing wrong, so you're wrong. It would be like you as a coder or a biller as a collector that made an error, and then your office manager basically says, okay, you make all kinds of errors. Well, that's unfair. So you have to really look at it from a target audit. So again, I'm happy to do those kinds of audits if that'll give you some information that you want internally, but it would not suffice if let's say CMS came in and said, you have a problem, we're seeing a pattern, or those new comparative billing reports, CBRs, that are administered by Centers for Medicare and Medicaid. They're developed and disseminated under a contract by a company called eGlobalTech. That's a federal services firm based in Arlington, Virginia. So they're new. They're basically now taking MAC carriers. They've been producing and disseminating limited numbers of CBRs to targeted providers for many years now. But now what I'm seeing is it's just there's an uptick in those. And what they're basically doing is they release a CBR to actually to an office or a practice, and then they don't give specific information. They say basically, we've seen a pattern of inappropriate coding or billing in your practice, and so we would like to just educate you. And then after they do it, they come out a few weeks later with a webinar or an educational piece saying, now you need to learn what you're doing. What I have found, because a lot of my clients have received some of these letters and they're panicked a little bit, I said, okay, they're targeting you for something, so let's take a look. And a lot of times it's independent testing facilities. It's not really an audit based on your coding habits. So for example, the recent one I got from a client of mine in Arizona, they got one basically saying that their referring physician was on 64% of their independent testing facility referral base. And so the norm for their geographic location or for their like specialty should be more like 48%. So they want to know, how come you're referring so many patients? And then they took a step further. This is to the independent testing facility, which is a freestanding diagnostic center, just kind of like your office, but one that you have financial interest in. But you also have to be actively treating the patient within 90 days. Otherwise, why do they need a diagnostic test that you're referring them for? And so basically Medicare, they look at that. They look at those kind of statistical issues. And the office was like, what did we do? I said, well, okay, so I don't need to come in for an audit for that, but here's what you need to do. And when you're a client of mine, this is the direction I give you. Yeah, I will not tell you you need an audit unless you need an audit. So this was not an auditing situation where they were saying, you were using these codes and this is what you supported, or, you need to pay back money because you didn't support this or that. What this was basically, I told the practice, you need to run a report and find out from your independent testing facility how many patients recently that your physicians names were on them referred, that you haven't seen them in the last 90 days. And then find out who has seen them that said that they needed to have that referral, because that's what they were looking at. So auditing from Medicare, I mean, they do pre and post, they do RAC audits, and the RAC audits are interesting because those are data analysis, those are random audits, revenue audit contractors, that's RAC. And what they find basically is they're looking to, well, first of all, they get paid based on percentage of errors they find. So to me, that's too much of an incentive. I used to do RAC audits a long time ago, and now I do pre and post audits for Medicare. But when I see the RAC audits, it's an incentive to find a problem. And so to me, that was not a good idea. And I wasn't, making much money on those, only because I was finding issues where they existed, but I was clear that I was not going to manufacture issues just so I got paid. So that was something that was interesting. But one of the things the RAC audit addresses is that they're looking at measuring the effectiveness of the remedy through targeted re-audit effort. And then you would have even more of a commitment. So they're trying to say, okay, well, considering how much is riding on coding in today's complex healthcare market and how hard it is to justify not investing in audits and education to boost your accuracy, I really believe that you have this window. And you really have to look at auditing no longer really is just a mechanism for mining, data for you and patient population studies. And, you're looking here because coding is the primary tool for measuring current and even future reimbursement, with many providers looking at compliance goals that are traditionally in the 95 to 100% target. So when you look at really, embracing an audit or a compliance plan to audit, you want to make sure that you're embracing it because you want to drive that excellence. I always talk to people about, taking things level up, take things to the next level. And I try to do that in everything that I do because I want to make sure that I'm not just good, I'm great. I want things to be great. And so we everything is so evolving, and you want your practice to be great. Remember those patients that are dealing with, patient satisfaction surveys, and they want you to be great too. And part of that comes with what you find during an audit. So there was a medical group, a client of mine outside of Atlanta, and what they did is their internal compliance team recently worked with a vendor and basically to do a baseline review of accounts. And then what they looked at was a lot of times they were having a really tough time because they said the physicians just kept saying, I'm here to treat patients, not to do paperwork. And so the hospitalists and the physicians, the doctors at this medical practice were having a really tough time trying to get on board with this. So then they called me and said, the third party vendor is not working. They are, business suits, and they're coming in kind of like an accounting firm and basically just looking at this as a statistical, audit. So can you come in and kind of conduct an audit and let us know how to unveil, some of these things for the providers? So what we went in and did is basically it started with making the providers feel comfortable and really saying, okay, so sometimes just noting what you need to have in a patient history that has not changed from the day before on a medical record, or saying something to the effect that, what the negative impact as far as smoking was to a patient. That's going to make a difference in a record. If you have a language barrier with a patient and you had to take time with interpreting services, that's going to make a difference. And in just talking to the physicians kind of at their level and making sure that they understand we are there for you. We're not trying to find errors. We are really looking at how to just improve what you're already doing, but taking your documentation to the next level, not just the baseline to adequately pass. We want to make sure that you are above reproach and looking at not only the improved accuracy in your coding, but improved overall compliance in your documentation. And once I've gone to a practice or once I've done an offsite review, I want to see at least a 15% improvement. That's my threshold. I've done my job if I can see that. And so a lot of physicians whose scores, when I first look at it, can you audit us? So we look at it and then we take a look and say, okay, here's what we need to do. And a lot of times they're between 50 and 70%. And when we leave and then we go back and check in a few months after that, we can get them up to that 85 to 95% mark. Nobody's perfect. I have found one perfect physician a long, long time ago. He has since retired, and so obviously he doesn't exist anymore, but you want to make sure that you want 100% compliance, but those are very tough to do. There's always going to be something missed. There's always going to be something that could have been better, but you want to be close to that 95 percentile because a lot of performance-based audits really focus on, should you be able to get your bonuses? Should you be able to get your value-based bonus? And really the approach of really looking at the findings to not only find out, are you compliant, but are you deserving of the reimbursement you're getting? That's what's going to help you argue your position with Medicare. So baseline audits really are completed on every coding professional to identify current quality levels, perform challenges. This is the one thing that I find interesting. Whenever an audit's done, it's always the doctors that get picked on, really looking at their documentation and, what they're doing. But the first thing I also ask as well is I say, how are your coders coding? Are they also capturing any services? And so I want to make sure they're brought into the process. And when we look at let's say I did an offsite audit, what I'll do is I'll say, please share this information with your coders because they should be spot checking your physicians as well. And it's amazing to me how many times I'll get to practices where we've done an audit and they say, oh, our coders don't spot check our physicians. I'm like, why not? You want to make sure that there's somebody policing the record, not policing the physicians, policing the record. That approach is going to be not only more cost effective, so you don't have to keep auditing all the time, even though you should do it at least once every 2 years, but it's really more of an individual coaching and development of the perfection of that documentation effort. And so you want to show improvement in these different areas of what the audit produced for you, of what you saw in the audit, including diagnoses that are linked correctly, were the procedures coded correctly, right modifiers, were hospital acquired conditions, was it consistent from what you picked up in the hospital versus how they were brought back into the office. And, this type of improvement impacts not only the financial well-being of the organization, but also the data, the quality of data, and also the reporting as well. And so you really want to make sure that you're understanding that many organizations complete audits and review findings, but here's what I find out. They're unable to accomplish more due to competing priorities and limited resources. I have so many practices that I'll do an audit for them and then I don't hear from them again. And they'll be just like, thanks, that was great. And I'm like, did you read the audit? You probably need to have a follow-up. So if I don't hear from them within a month, I will follow up and say, we need to go over results with the physicians. And they'll be like, oh, they're just so busy. I'm like, okay, but did you read the audit? They only passed with or they did or didn't pass with this percentage. And usually it's not past 80 if I'm calling them back or asking. And so when I look at those results, and then I see that the organization doesn't even, respond to it, and they basically are focusing on more critical priorities with the expectation of focusing on the audit later, then we get into dated information. I recently did an audit back in January, and big practice in mid-central California, and they had 10 physicians, and it was not good. I mean, it was not good. And I said, okay, we immediately need to get this on the books for education. You had a below 50%, passing of the audit, or I should say failing of the audit, and it was not good. And so then they said, okay, well, we will definitely schedule that. I gave them some dates. Didn't hear from them. Then went to March. I said, okay, we are now 60 days from that audit. Well, it just kept going and going, and soon enough, we get into July, and now we are 7 months past that audit. And at some point, because July 1st is the fiscal change for Medicare, where they update things like, they bring in certain things on the exam and the documentation efforts. And sometimes now the results are going to be dated, and I have to change now what the education part is, or I would even have to change what I'm looking at from an auditing perspective. And I basically said, look, we either talk about this and get this on the books by, July 30th, or you have to redo your audit. And a lot of practices, then they say, oh, shoot, we didn't get a chance to look at it, and now it's time for another annual audit. And things still haven't been addressed. And so new issues may be now identified while old issues remain. So, and though quality coding may not be worse overall, it probably hasn't improved. And again, that's resulting in the loss of money. I'm not going to say revenue, loss of money, and continued compliance risks. And you don't want that. And so audits, really demonstrate significant opportunities for the improvement not only of coding professionals' performance and the optimization of revenue and reimbursement. So, for example, a 2% sample of inpatient records at a large hospital system I did found that reoccurring DRG errors reflected $74,000 in lost revenue in a single quarter. So audit findings reflected repeated errors of incorrect principal diagnoses or procedures, as well as a lapse in capturing all comorbidity conditions, and resulted in underweighted DRGs and costly underpayments. And so, for 25 years, I did strictly physician, and last 5 years, I've also gone into the hospital genre. And it's just amazing to me how much money is left on the table. And just by simple things that could be fixed just by providing an audit sample, just get that up. And that way, coding performance and documentation accuracy, it's just never been more important and critical to an organization's compliance and financial health. So organizations that invest in compliance audits can really improve their return on investment by adding education, focused audits, and that can result in better data and optimized revenue capture. And so we just want to make sure, and this is really why I wanted to talk about this today, especially with what we're going to be dealing with that proposal with CMS. And I know I keep bringing it up, but I can't help it. It's sticking with me. It's been out now a couple of weeks, and I can't seem to get over it. Somebody said I'm like a dog with a bone with this thing. And I'm actually going to be on ICD-10 Monitor in a week just to talk about this in our Talk 10 Tuesday. And it's ongoing. It's something that you really just can't get away from. If you are a Medicare provider, if you are a commercial plan provider, remember, Medicare, whatever they do, the commercial plans follow suit. So you can't look at resource constraints as being a hurdle to compliance improvements. Given the risks of taking zero action, and it's just even small steps toward a performance-based program will have truly a positive impact on your organization's overall coding quality and compliance. So as these programs progress, organizations may want to consider taking even more creative and cutting-edge steps in compliance. Now, a lot of practices, or especially in the hospitals, they want to do pre-bill audits for high-risk DRGs. which are diagnosis-related groupings, and that's for the inpatient facility coding. I find that to be a little bit daunting only because the pre-bill scrubbing process can be an issue. In the physician's office, when you do it as a post-review, if I find something that should not have been coded, now E&M is different because it's very subjective, but if something really was submitted and shouldn't be, then you'd have to send a refund. But no more often than not, I find services that aren't billed. And so this is where you really want to look to, not just boost that knowledge and accuracy, but there's a fine line between successful audits and missed opportunities. And so we want to make sure that you know that there is a huge impact on your reimbursement, your overall patient care, and the success of your practice if you really don't embrace the whole auditing perspective. So really, if you need some help, contact us. Make sure that you're on board with this, because it's just something you're going to need to do in your office, especially with what we're dealing with now, where it's not if you get a formal audit by a payer, it's when. And so be proactive and make sure that you have crossed all your T's, dotted all your I's on there. So I hope you appreciate some of that information today. Again, we're always here for you. Love to hear from you. Catch me on social media, TerryCoder1 at Twitter, or you can catch me through email, and I have 2 email addresses, terryfletchercpc@aol.com. And for those of you that want to make fun of me, you can go to my Gmail account, terryfletcherccc@gmail.com. And I want to end with my sponsor today, Healthcare Executive. Healthcare Executives Network is the fastest growing community for healthcare executives and their trusted partners, healthcareexecutivesnetwork.org. Also, I wanted to let you know, I appreciate you listening and sitting through some of the sponsorships and the commercials. I'm sure you've heard it, right? When you log on or download, or you get a notification for the podcast, there's a commercial that plays in front of it. That's what keeps us on the air. Podcasting has an expense to it. So I do appreciate you listening through all of that. I know sometimes you're like, oh, really? But, I really appreciate that. And we appreciate our sponsors. So they said they're getting a lot of good feedback, and they really enjoy being part of our Codecast podcast. And a couple other things I just wanted to bring to your attention. I think I have a problem and need an intervention with podcasting. I'm really liking it. So I have a couple other ones if you're interested. If you've had enough Terry Tuesday, I totally get it. And I'd like to call it that because it reminds me I have something coming up on Tuesday. But I have a couple of podcasts just if you're interested. One is called the Bun Life Podcast. I do it with my friend Corinne Briley. And basically you can find that on iTunes, and it's called the Bun Life, BUNLIFE podcast. You can also find it on our website at thebunlife.com. It's basically, we're 2 moms. I have adult children. She has young kids, and we are pretty funny. We're just comically showing the intersect between working and motherhood and dealing with, husbands and partners and spouses and all of that. So if you want to just laugh one night listening to us, we definitely get crazy. And I think they're going to start letting us bring in wine when we do our podcast. How cool would that be? And the other one I do is called Steel City Underground, and I love my Pittsburgh Steelers. And so I just finished an article today, actually on an injury to one of our offensive guards, Ramon Foster. And so I just posted an article today on that injury and making sure the medical part of that's covered. But I also do a weekly podcast that's going to start up as soon as we get into the regular season at steelcityunderground.com. And that is, it's called WTF. And, get your mind out of the gutter. It's called What the Football. I'm just kidding. But that's really what we're looking at. Just all the things that happen in the NFL. I love football. If I wasn't a Steelers fan, I'd be a Kansas City Chiefs fan. And actually, I just went to a Rams training camp practice today before I came into podcast. And that was fun. They've got a 30-year-old coach out of there. That's pretty funny. And he's nuts. And then there's another one I'm coming up with, and this is the last thing I'll kind of promote on here. And it's called The Business Collective. And I've just recorded 3 episodes. It is not able to get yet, so I'll let you know when you can. A lot of you have asked me, Terry, how can I be you? And that's so sweet. And I think what you mean is, and this is what I've gotten as far as feedback, how can I go from employee to consultant? How can I do what you do and be able to make money at it and be able to be, kind of successful at what I'm doing, but really work my own hours and kind of set my own course now that I've have that experience under my belt. So again, the Business Collective, it says Business Collective by Terry Fletcher, and I'm working on that. So that's going to be coming out in the next probably couple of weeks. My target date actually is September 1st. So hopefully that is something that you're interested in and you just want to see how can you take your career to the next level as well. So we really appreciate, again, everybody listening in. And also thank you to all that voted for the podcast awards.com. We hope that we won our award. We're in 3 categories, so we'll find out in the next couple of weeks here. So everybody, thank you again. Make it a great day, and we'll talk to you next time on the Codecast podcast.
For more information on medical coding, billing, auditing, and compliance, including how to hire Terry, follow Terry on Twitter at TerryCoder1 or visit her website at www.terryfletcher.net. Podcast producer Joe Kuzma. Music producer Dassassin Music.